good evening, everyone. All my supporters, all my friends, everybody who's been following. I want to say hello to all of you. I'm sorry there's a little disconnection with my system here. But my name is Jean Bastilla. I'm with AW Interesting Topic. I'm here to talk about anxiety. Anxiety disorders. Again, as you guys know, usually I focus on talking about seniors, about issues that our seniors face and community. However, we also try our best to talk about things that affect health in general, things that we know our community is suffering from, such as what we're going to talk about today, anxiety disorders. So a few things we'll look at today, we'll look at what anxiety is. Because anxiety, again, many of us, we may not realize it, but many of us suffer from some type of anxiety. So we'll talk about what is anxiety, we'll look at different type of anxiety, and then we'll look at ways that we can help decreasing our level of anxiety, or how we can help a friend, a family member to decrease their level of anxiety. Again, this is what I do. This is what I will continue to do, is to bring education to you all, bring education for my community that I love very much, and especially my community seniors. So let's talk a little bit about anxiety, a disorder that is very common in our society, especially among our seniors. What is anxiety? Well, anxiety is a deviant, distressful, dysfunctional, it's kind of a group of all those thoughts, that dysfunctional thoughts, distressful thoughts that lead to our inability to function well in society. It can be something that is normal. We all have a level of anxiety within us. It is okay to be anxious. Every once in a while, we will be anxious, and this is fine. But it is a problem when it interferes with our daily activities, when it interferes with things that we do on a regular basis. So this is very important that we think and we talk about it so we can see how we can help decreasing the level of anxiety. Everyone watching right now, you cannot tell me at one point that you did not have some type of anxiety issues, or you don't meet many people at your work, when you go to the store, at school, or wherever you are, you meet so many people with anxiety disorder. Now, to address any issues, we have to get to the root. We have to get to where it came from. Why are we anxious? What is anxiety? What causes us to be anxious? Well, it is nothing but a negative thought. It is a group of bad thoughts that we have that cause us to be so anxious. So again, if we know the root of a problem, it's easier to solve it. So, that causes them to have fear, and that causes them to be anxious. Now I'll give you guys a very simple example that we can take. Saying you're driving. One time in the past, you had an accident. I'm so anxious that I will have another accident. So here you are, you driving, but you thinking so much about you having another accident that it causes you to be so anxious and get you into a panic. So again, it's negative thoughts. So a lot of the time, people who are anxious, they keep thinking negatively. You are at your work, instead of thinking, oh, I'm good, I'm a very good employee, fire me. So again, those negative thoughts are what cause you to be anxious. That's what causing you to have so much anxiety. So you keep thinking, oh, it's not gonna happen. It's not gonna happen. You sick, but you get so anxious because you get bogged down in trying to think of you not getting better. Instead of thinking you should get better, then you're thinking you're not getting better. You get this job here, you're working. Oh wow, what if I make a mistake? So all those negative thoughts are what causes our anxiety level to go up. At nighttime, instead of you going to sleep, you lay down in your bed and you thinking about how you're gonna pay your bill the next day. It's like you thinking that the negative thoughts is gonna solve the problem, but it will not. What you need to do is actually to be focusing on positive thought. That's how you can fix the issue with your anxiety. Okay, saying some people who have anxiety when they are in an enclosed area, like they are so anxious. Well, if you keep thinking that way, then it leads you to a panic, and you have a panic attack is a very high level of anxiety. If any of you ever seen somebody on a panic attack, you would know exactly what I am talking about. Those people, they out of control, and you could see it. It's an emergency. It caused them to have tachycardia. The heart rate is up. They start breathing hard. They have chest pain. A lot of them, they have to come to the hospital, and you have to do cardiac workup on them because of just anxiety. Okay, if they have anxiety issues or they had a panic attack, now it causes them, they are having anxiety of having another panic attack. Saying if they were in a car and on a bus and they had a panic attack, so next time they have to take a bus, they are thinking maybe I'll have another panic attack while I'm in the bus. So that caused them to have even more anxiety. You also have anxiety of public speaking. Saying I'm talking to you right now, hey, I may have that anxiety that people are listening to what I'm saying, they're thinking I'm wrong in what I'm saying. So all this is anxiety. They don't want to be where people are. So they stay isolated in their home because of those negative thoughts. And a lot of the time, people with anxiety, they are thinking about a lot of things that are not existent. They are thinking of things that would never happen. They're thinking of things that are out of the picture, that would never happen to them. But because of those negative thoughts, they keep thinking that, oh, you know, this is gonna go this way, this is gonna go that way. You know, have you ever been in a situation where your next day to go to work, because something happens on the floor where you work or wherever you work, then you thinking, oh, today I will be fired, they're gonna fire me. And when you go to work, somebody say your boss is asking for you. They ask you to come to the office, and you're like, oh Lord, look at what's gonna happen to me. But then what happened when you go there, instead of firing you, they give you a promotion. So sometimes we have those negative self-talk that don't help us. They do not help us. All they do, they make us sick. Because remember, with a high level of anxiety, it causes your blood pressure to go up, because it causes you to have a lot of stress. So really, a lot of the time, being anxious does not really help us. Being anxious only make us worse. Because anytime, saying if you have anxiety of being next to a cat or of seeing a snake, okay, some people think when they call that phobias, okay, that's a type of anxiety, phobias. So if you have anxiety of being where a cat is, if you have anxiety of crossing a certain bridge, if you have anxiety of being in a big crowd, every time you see a big crowd, what you do, you avoid the crowd. But you know, guess what? That's actually reinforce the anxiety. It makes it worse. People think, okay, yeah, I'm getting better, but no, it doesn't help you get better. Every time, when you have anxiety, every time you get to a situation where you're being exposed to that element that you're anxious about, and you fear, you avoid it, it causes your anxiety level to go worse. So actually what you want to do is to face the situation. If you're having phobias of public speaking, you have to expose yourself so you can speak in public as much as you can. If you have phobias of being in a big crowd, you need to ease yourself into the crowd, because every time you try to avoid it, it causes your anxiety to go worse. So you need to not avoid the situation, but you need to face it. Again, anxiety can make your life very miserable. It can take you to hospital. It can cause you to have a lot of issues. It can cause you to not being able to have very good relationship with your family, with your loved ones, with your partner at home. So it can really cause a lot of issues. But what you want to do is to manage it. You don't want it to take over, but you want to be in control. Stop thinking negatively. Start thinking positive. Start thinking that you can make it. Start thinking that you're healthy. Start thinking that you'll be able to afford your mortgage. Start thinking that they will not fire you at your job. Start thinking instead of firing you, stop thinking that they will fire you, but I want you to start thinking that instead of firing you, they will give you bonuses. They will give you raise. That's what I want you to think. You have to think positive. Because when you think negative, all it does, it makes you anxious. It makes your heart rate go up. It makes your blood pressure go up. But it does not help you to get better. So what you want to do is to think positively. Always look at it. I understand. I'm feeling that way. But it will get better. Okay? Because again, the whole thing about anxiety is thinking negative. If you think negative, you will be anxious. Right now, when I leave the office, if I think that I'm going to have an accident on the highway, I'm going to be so anxious, and actually can actually happen because I get so anxious. If I think it will happen, if I'm thinking it will happen, I'm thinking it in my mind, it stays there and I keep thinking about it, then this is when those things happens to you. So what you want to do is avoid thinking negatively. Why are you thinking that your partner will leave you? Why are you thinking that your kids will not be successful? Why are you thinking you won't deliver a healthy baby? Why are you thinking you're going to have cancer? You don't have to think those negative way. It's better to have positive thinking. Let's think a healthy life. Let's think a happy opportunities. Let's think in a way that we know that we'll be fine. Don't be thinking negative, because this is what causes us to be anxious. Because that's all it is. Anxiety is just our thoughts. It's just bad thoughts about certain things. Say somebody with OCD, for instance. Somebody with OCD, for those of you who don't know, OCD is obsessive compulsive disorders. Those people, they're thinking, again, bad thoughts. They're thinking, oh, if I don't clean my hand well, you see those people who wash their hand 100 times in a minute, they have to wash it. They always think their hands are dirty. They always think they have to clean it so well because there will be germs, it will kill them. So really, at the end of the day, when you think negatively, you become anxious, and it causes you to be involved in some bad behaviors, which in OCD we call that ritualistic behaviors, where you keep doing this thing over and over. You're like, oh, I have to clean this. And again, when we say OCD, I know sometimes we joke around with our friends, say, oh, you are OCD, because they just like to clean their bathroom every or twice a week or once a week. But this is not what we're talking about. But we're talking about somebody who is cleaning so much that it becomes a problem. Like every minute they have to clean. That's what we're talking. We're not talking about just somebody who just try to make sure their clothes is clean and neat. So we're talking about somebody who repetitively do this behavior, and they keep doing it. But guess why they do it? In OCD, those people, they do this because they are having those bad thoughts, those you could call it irrealistic thoughts that don't make sense, thoughts that are not true, untrue thoughts. That's what causes them to feel like every time I should wash, because they have the thought of getting germs. So every time you anxious, it's because you have those bad thoughts. And what you want to do is brush them off, bring positive thoughts. Every time those bad thoughts comes, in your mind, you wanna turn it off and turn on the positive thoughts. When I talk to my patient at community health, when I do mental health, I always tell them, you have different channels that you can turn on to. Your brain is like a TV. And on a TV, when you're watching, if you're watching the sport channels, you don't like it, but guess what you do? You turn it off. And you turn on the channel where they have the news, the channel where they have another show on that you like. So that's all you do. So you don't have to sit there and watch this bad channel thinking so negatively, but you can turn it on to a positive thoughts. Be positive. You turn on your channel, you turn on to the good channel. Instead of thinking negative, then you turn it into a positive situation. Don't be thinking they're gonna fire you at your work. Don't be thinking you're not healthy. Don't be thinking if I use this water, it's gonna kill me. Well, you have to think, hey, if I drink this water, it's fine, it's good water, I will be fine. Because again, those negative thoughts is what is causing us to be so anxious and causing us to get sicker. So I want you guys to start thinking about switching off the negative channels, switching off the negative thoughts, but turn it into positive thoughts, into something that is productive, into something that is more positive. Because that's all can causes you to be anxious. When you're watching this video, if you think about yourself, if you think about your life, in many situations where you get so anxious because you have those bad thoughts. You have those thoughts that something will happen to you. You have those bad thoughts saying, if we talk about seniors, sometimes they have the thought of, I'm at home by myself, what if something happens? Again, it's all negative thoughts. What if I fall? What if I end up in the hospital? What if my parents decided to put me in the nursing home? So all those are negative thoughts that cause us to be so anxious. Again, I would say, really in one word, you could say anxiety equal negative thoughts. It can be not too bad or very bad. Because again, anxiety is something that can prevent us from working. Many of the patients I take care of, many of them are on disability just because of anxiety. They are so anxious they cannot hold a job. They cannot hold a position. Because wherever they go, they see all those people and it just makes them sick. So they cannot. So what we want to do is to be positive. Some people it's very hard because everybody's brain works differently. For some people it's very hard for them to not be so negative. I was talking to one of my patients today and we were talking about a relationship. She's so anxious about getting a new person in her life because of what her husband did for her in the past. And I was telling her, I'm like, you know what? You should go and read about some of those guys who are very successful today. Some of those guys who are doing so well today and see how many times they fail. So part of life is failure. So we have to accept to fail at times. We're not always going to be successful when we try something. So what I try to tell her, because I know a lot of people, they say, if I was in a relationship, and I know this is not about relationship, but all those things, when I work in mental health, I talk about all those things when we talk about anxiety. If you're in a relationship, you feel so anxious about going to meet somebody else, then you will get stuck. So if you were with that one person that treated you so badly, and the purpose probably of treating you bad is because they want you to feel bad about yourself. They want you to be so anxious about meeting somebody else. And when you meet somebody else, guess what? You win, they lose. So their goal is to see you never have another boyfriend, never get married again, never have another partner. But what you need to do is to make them lose by making sure you go and meet somebody else. That's part of life. You cannot be anxious about meeting somebody else. You cannot have those negative thoughts that whoever else you meet is gonna be the same situation. You have to go out there, meet somebody else and see how it goes. If it doesn't go well, hey, you're gonna try again, because again, part of life is defeat and success. So sometimes you fail, sometimes you succeed, but you cannot let fear and anxiety be on your way. And this is why today I had so many patients with anxiety issues, and I was trying to talk to them about how you cannot let this anxiety be on your way and you cannot move forward. You stay where you are, you stay stagnated because you're so anxious. You can't let this happen. So I was talking to them about it, and I felt like, maybe that is a good topic to share with all my viewers, to share with all my friends who've been following me on Facebook, Twitter, Instagram. So I think it's a very valid topic, because when you look at anxiety, sometimes people don't realize it, but it is just negative thoughts. If you turn off all those negative thoughts in your life, you will be less anxious, or you have no more anxiety. All you have to do is to switch off. Say, I don't want to think about that negative stuff. Let me think about something positive. Again, as I said, it's like a TV. When you're watching a channel that you don't like, guess what you do? You turn it off and you turn on something that you like to watch. And it is the same thing when you are dealing with anxiety. So if you don't want to be anxious, you don't want to be thinking about those negative things. You don't want to be about those negative people who brings you down, who tries to make you even more anxious. You want to be around people who have positive thinking. People who are encouraging you to do better. People who help you, who boost you to do better. But you don't want to be around somebody who is pulling you down, who's making you feel so bad about who you are, who's making you feel like things will happen, and when nothing will happen. A lot of the time we're anxious for no reason. Again, you'll be thinking something will happen to you, but then it's something totally opposite. And again, I do have not just my patients, but I do have some family members like this. And a lot of time I talk to them, telling them, hey, no need to be feeling that way. And sometimes they will come back and say, well, you are right. Actually, what I was thinking was wrong. I was just anxious for no reason. So why letting all those negative thoughts into our life? Why don't we turn off those channels of negativity, and turn on the positive, the happy channels? That's what we need to do. Again, if you're watching here, my name is Jean Bastilla. My job is provide education. Mainly, I am one of the guys who've been fighting for seniors mainly, but I do education for our whole community, but mainly I focus on seniors. So I believe this topic here is a topic that is related to seniors, because we have a lot of them who have anxiety about many things. They have a lot of comorbidities in their life. They have high blood pressure. They don't know when they're gonna have a stroke, so they're anxious. They're thinking about that. Some of them, they have cancer, end-stage situations. They have renal disease. They are on dialysis, and they see their friends die. All this causes them anxiety. Again, one of the things I know, yesterday when I talk about depression, I failed to mention that. But I went as far as anxiety and depression, psychotherapy is very, very important. You could use psychotropic medications, but also psychotherapy. So when you put psychotherapy and psychotropics together, it is a better treatment. And again, sometimes psychotherapy may not be good enough, so you add a little bit of medication and then you pull the medication and they continue psychotherapy. So anxiety psychotherapy is pretty good. You could get a therapist to talk to you. They can kind of help you. A lot of time we give a medication like Buspar or Xanax or Valium, Klonopin. Those medications are some of the medications that we give to our patients. And again, if you have to go to somebody who knows about those medications, this program is not to tell you this is what you have and this is what you should have. You still have to go to your doctor and talk to them. My patients, when they come and they talk to me, I just assess them and see what they need, and that's how I go about treating them. But again, This is what we're doing. This is what we do. I want to say thank you to everybody who have been very faithful in watching my videos. People who've been following me on YouTube, on Twitter, on Instagram. So thank you very much. I hope you guys continue to help me with this fight, the fight that I'm doing, the fight of educating our community, the fight especially of educating our seniors. Again, I'm Jean Bastilla. I'm with AWC Home Care, the home care company that makes sure that as many seniors are able to stay at home where they belong, and as I always said it, and I will continue to say it, where they feel love. Our number is 678-696-9905, or you can visit our website at www.awchomecare.com. Thank you for watching, and you all have a great and pleasant evening. I love you all. Take care.